Thank you, Megan. Good morning, everybody. Thank you for joining this very informative session today. My name is Anne, and just a brief introduction about myself. I work with the Lifelong Recreation Unit, a small piece of the pie that is Seattle Parks and Recreation. And with the COVID situation, we have converted a lot of our in-person programming into virtual and hopefully some outdoor opportunities as well. So with Washington Poison Center, we're excited to bring several sessions and informational events with approximately one per month. I think we're skipping September, but Megan can go over those details with you. This is one of the events that we hold is educational workshops. We also are working on some fitness programs, some other social activities. So stay tuned. A lot of our virtual events will be kicking off in October. So we do have an e-newsletter. If you'd like to join that, you can we can connect after the event, and I can help answer any questions that are related to Seattle Parks and Recreation or the Lifelong Unit, which is for age 50 plus. And I think that's about it. So I will turn this over to Megan, and I'll be here during the entire event as well. So I'll see you afterwards, and I'll also be watching the chat and can interact with you that way too. So hope you enjoy this very awesome talk that Megan will be leading.
All right, thank you, Anne. Okay, everyone, just a heads up, we're also live streaming this on Facebook. So because of that, we're asking everyone to stay muted. So if you have any questions or comments, we're gonna have you pop those in the chat box. And we'll go over a little bit of housekeeping on this next slide. All right, so thank you for joining us today. My name is Megan King, and I am one of the Public Health Education and Communication Specialists at the Washington Poison Center. So this has been the hot topic for the last 6 months, and it is still very much relevant, even though we are so far into this pandemic. But I'm excited to share with you today some of what we're hearing about at the Poison Center, as well as some easy strategies to make sure that you do not have to call us at some point. So we'll go ahead and get started with some housekeeping first. So again, we'll have you stay muted. We'll have you ask any questions you have in the chat box, or if you are tuning in from Facebook, please just comment with any questions that you have, and I have that open as well, so I will be able to address any of those questions. You'll see that you have a little control panel as a participant or as an attendee, and I've posted in the materials section the slides for today, as well as some of the other materials that we're going to cover. For those of you on Facebook, I'll just put our website as a comment, and you're going to be able to access all of these materials on our website. We will be recording today, so this will be available for viewing later on, and for those of you who have registered, I will email this recording out to you. And before we move on, I just want to give a shout out to my colleague Alex. He is working the tech back end of all of this. He's running the live stream, and he's going to be launching any polls we have today, and will help me moderate with the chat box. All right, so here is our agenda for the day. I'm going to start with just a brief overview of the Washington Poison Center, who we are, what we do, and then we are going to dive into poisoning during this pandemic. We're going to talk about household cleaners and disinfectants and other household poison risks. And then we're going to round out the presentation by just quickly going through what to expect when you call us, because we want to make sure that you are comfortable and know what the experience is going to be like when you give our poison helpline a call. So let's get started with the Washington Poison Center. And first, I just want to set up what I mean by poison. So we take a very, very broad definition of this at the Poison Center. For us, it's any product or any substance that's used the wrong way by the wrong person or in the wrong amount. So that obviously applies to a lot of different things. There's what you would traditionally think of as a poison, like bleach and chemicals, but it also applies to just regular run-of-the-mill cosmetics and craft supplies, flowers, plants, berries, fumes, vapors, snake bites, insect stings and bites, medications, alcohol, drugs. The list just goes on and on. Really, anything can be a poison. And to further broaden that definition, there are also lots of different ways that you can be exposed to a poison. There is breathing in a poison, so inhalation, ingestion would be swallowing or eating something. There can be eye exposures, skin exposures, and it's important to note that something that is not poisonous through one route, like through putting it on your skin, can very much be poisonous if it is ingested or if it gets in your eyes. So the Poison Center, our mission is to prevent and to reduce harm from poisoning. And we do so through our public health education, which is what I'm here doing today, as well as our Poison Center telephone helpline. And this is really our bread and butter. This is the phone number, and it is a national toll-free telephone number. So you can call this from anywhere in the United States, and you're going to be routed to your local poison center. All poison centers are open 24/7 every day of the year. We are always free, never going to ask you for insurance or any sort of payment. We are 100% confidential. HIPAA laws, like what protects you at a doctor's office or a hospital, that applies to us as well. And if English is not your primary language, we have access to interpretation services in over 260 languages. So this next slide has a little bit of our call data from 2019, so from last year. And I wanted to share this just to give you an idea of the volume of calls that we receive each year, just to point out that if you call us, you're not alone. So you should really never hesitate. So last year, we received over 125,000 calls regarding more than 66,000 cases. So there's a difference in number there because a lot of times cases are going to involve multiple calls. So that means we're going to follow up with you when you call us. Or if it's a more complex case, we might be calling back and forth a few times. All of these calls are coming from a lot of different sources. Many of them are coming from home, but also from workplaces and schools. We receive a fair amount of calls from medics and EMTs as well, who are either on the scene of an accident or they're en route to a healthcare facility. So we can assist with either treatment on the way there, set them up for whatever treatment should be at the hospital, or we can potentially even tell them, hey, they don't need to go to the hospital. You can stop that transport. We receive a lot of calls from emergency departments and healthcare providers as well, who just need some additional assistance on more complex cases. So who are these calls about? Unsurprisingly, close to half of our calls are about kids younger than 6. If you've ever been around a child, you know that they explore the world with their mouths. They are constantly getting into things that they probably should not be getting into. So it's very unsurprising that a lot of our calls are about young kiddos. But we are very much not just for kids. We receive a lot of calls about teens, adults, and older adults. And these calls actually tend to be more serious than those in the little kiddos because they might be medication-related errors or more extreme non-pharmaceutical product exposures. Okay, so we've set up what the Poison Center is. Now we're going to start talking about poisoning during COVID-19. So we obviously have a huge, very broad definition of what a poison is. We receive calls about so many different substances. So our folks who answer the calls, they bucket calls into different categories, which is up here on this slide. So there's 3 main areas. There's unintentional exposures, adverse reactions, and then intentional exposures. COVID-19 has really just exponentially increased people's risk in all of these different areas. We're going to go into the reasons why risk has increased so much, but our lives have been so disrupted that really any of these different exposures are more likely now. We don't have hours to sit here talking about all of these different exposure categories though, so we're just going to focus today on the exposures that are in orange, which are medication errors, accidents with non-pharmaceutical substances. So those are both under the unintentional exposure bucket. And then we're going to talk a little bit about intentional exposures, including suspected suicide, misuse, and abuse. So why does this pandemic increase our risk of poisoning? There are so many different reasons why, but it's basically the main thing is that we are at home more. We have all been forced to really establish and maintain new daily routines. And that has really complicated our day-to-day lives, essentially. So if we ever relied on memory for certain things, because we have these new daily routines, we're not going to have those cues anymore. We are probably cleaning our homes a lot more, especially if we're going out at all. And that means we probably have more products at home. Because we are at home, we have a lot more increased access to those products. And then we're pretty stressed still, even 6 months in. This is a very stressful situation. And when folks are stressed, they tend to have a lot less focus, are more easily distracted, and can have some mistakes with the products that are in their home. And there's also been a lot of rumors and misinformation that have been spread about the pandemic, about treatment, about prevention, and that can all affect our ability to stay safe. So we are seeing an increasing number of calls, especially about substances that are common to COVID prevention, like hand sanitizer, household cleaners, as well as increases in specific demographics that are they're vulnerable in general, but are especially so now during this pandemic. So specifically, we've seen increases in adolescents, ages 13 to 17, and then adults 60 plus. Our trends here in Washington, they parallel what we're seeing across the United States. So we are not alone in what is happening here. So I'm going to share some data points throughout the presentation, but you can also access all of our data snapshots that we've put together on our website. And when I take a break to look at the chat box, I will throw that link in there so that you all can have access to that. Okay. So let's get started by looking at some of these specific substances that we're encountering. And first, actually, I'm going to check the chat box, and I'll put that link in there now while I remember. So here's where you can access our data. Okay. So household cleaners and disinfectants. This is a very broad category. There are so many different substances that can be included in here, mainly cleaners, disinfectants, detergents, soaps, a lot more. So these have always been top substances that we have received calls about. But during COVID-19, a lot of people are using these products more. They have more products in their home. They're distracted, etc. All of those things that we just talked about. And so people's risk of being exposed to these cleaners has increased a lot. And I do want to point out that, you know, we're not telling you in this presentation to not use these cleaners and disinfectants and not take all these precautions, but we just want folks to be careful because cleaners can very much be helpful in preventing the spread of the virus, but they can also be harmful if they're used incorrectly. Okay, so we're going to launch a poll really quick, and I'll have Alex do that. So during COVID-19, what do you think is the most common reason for bleach exposures that we're seeing? I'm sorry, folks on Facebook, you're not going to be able to participate in the poll, but if you want to respond, you can go ahead and just pop that in the comments. All right, Alex, I am unable to see how many folks have responded, so you go ahead and just close that whenever you think it's good. Great, and you can share those results with everyone. Okay, so about a third of you thought accidental exposures, and then about 2/3 are thinking misuse, so not using a product the way it is meant to be used. And if we go to this next slide, those of you who said misuse were correct. We have seen a 62% increase this year in misuse of bleach. So that's people who have either unintentionally or intentionally used bleach in a way that it is not meant to be used. That could be putting it on food products, using it on their masks, accidentally not diluting it the full amount. There are lots of different scenarios involved in bleach exposures. So that is specifically for bleach, but just in general for household cleaners, bleach and rubbing alcohol, we have seen a pretty hefty increase as well at about 54% compared to last year. And because we are here in partnership with Lifelong Recreation, I wanted to call out specifically for older adults what we've been seeing. So misuse has increased 35% in adults 60 and up. And the top substances in this age group that folks are mistaking or are having mistakes with are bleach, hydrogen peroxide, and other disinfectants. So how do we prevent having exposures to household cleaners? There are lots of really easy tips that you can implement at home that can make sure that you stay safe around these. So first is just safely using them by wearing gloves, so that's going to prevent any skin exposures from happening, opening windows and doors to make sure that there's adequate ventilation, and then very, very important, reading and following all directions and safety warnings. So this seems like a no-brainer, but we do receive a lot of calls about people who are maybe using new products that they aren't as familiar with, because it was really hard to find cleaning products for a while, especially when the pandemic first started. And so folks might be using some products they're not as familiar with, they don't know the directions for as well. So make sure you read those labels really, really closely. If it's a product that needs to be diluted, make sure that you are diluting it to the correct amount. More concentrated does not mean it is better or more effective. In all likelihood, it would just increase your risk of having an inhalation exposure or dermal exposure or some other form of poisoning. The next tip is to never mix cleaning products. So sometimes when you mix cleaning products, it can produce hazardous gases. Bleach is the big culprit in this. You should never, ever mix bleach with anything other than water or what it says on that label for you to do. So make sure that you check the product ingredients on your cleaning product packages, because sometimes they're not going to be specifically called bleach or ammonia. It might say sodium hypochlorite, it might say ammonium hydroxide, so just read those product ingredients. You can always call us at the Poison Center if you're unsure what is safe to do, but really the rule of thumb is to just never mix products together, and also be careful when you are back-to-back cleaning with different products. So this slide is actually going to talk about one of the things that someone commented on in the chat box, and that is to not use cleaning products on food. So there is really, the CDC has talked about how there is no evidence that COVID is being transmitted by food. So there is no need to use cleaning products on your food products. So really just the best way to make sure that you are preventing transmission is when you get home from the grocery store or home from the restaurant, wherever you've gotten takeout, just wash your hands after you get home, and then before you eat, wash your hands again. If you have any produce, please don't use cleaning products to clean that produce. Don't put bleach in water or anything. Just wash your produce as you normally would with water. There's no need to go to any further extremes than that. We're also receiving quite a few calls about folks who are using cleaning products on their fabric masks or their cloth masks. So when you spray, soak, or wipe masks with cleaning products or disinfectants, when you put those masks back on, you can actually have some skin irritation due to that dermal contact, and you can also inhale fumes. So that can lead to poisoning. So really, for your cloth masks, all you need to do is wash them with soap and water. You can throw them in the dryer as well, because that heat will help kill things. But please don't spray, soak, or wipe your masks with any kind of cleaning product. Then safe storage is key with all of these products in our home. So you want to always store them in their original containers. So this slide here has a Gatorade bottle and a Lysol bottle, and you'll see that they look essentially the same. The color of the product is the same. So we receive calls from people who have diluted a product and they don't want to get rid of the remainder if they didn't use it all, so they might just store it in an empty Gatorade bottle or something. Well, that can be dangerous because it looks a lot like something that you can actually drink. So you might have someone then accidentally ingest or drink that product. When you are storing these cleaning products, be sure to label them with something that is very easily identifiable. So at the Poison Center, we have Mr. Yuck, who is this green guy on the slide. So you can go to our website and we'll send you some Mr. Yuck stickers for free, but you don't have to use him. You can really use any sort of labeling that is very clearly visible. You could use a piece of tape, you could use other stickers, you can use markers, color in different things, lots of different options. And then always store those products up high and out of reach of any young children that might be in your house. So one more time, this is our phone number in case you have any questions. You don't have to call us with a poison exposure. You can call us and just ask for information, ask questions. If anything, our call center staff prefer that because hopefully that means they're going to be preventing a poison exposure later on. All right, I'll quickly look at the chat box. I think we're good. So we are going to move on to medications next. Let me check Facebook too. We're good. Okay. So medications, again, just like those household cleaners and disinfectants, they've always been a big concern for us at the Poison Center. And so what we receive a lot of calls about are medication errors, which are essentially these 5 things. The wrong dose, so someone accidentally takes their medications twice, or they take 3 pills when they were only supposed to take 2 pills. The wrong medicine, someone took NyQuil instead of Pepto-Bismol. The wrong person, so someone took their spouse's medication or even their pet's medication. The wrong time, so someone took their pills at dinner time that they were supposed to take at breakfast. And then the wrong way, someone accidentally ingested something that was only supposed to be put on their skin. So like I said earlier, these errors have always been a top concern for us at the Poison Center for all ages and at all times. But we're especially concerned about medication errors for older adults. And even more so now during the pandemic because of all of those changes that we are experiencing. So those new daily routines might remove any memory cues that we have for taking medications. For example, if you always grabbed your medications or took your medications as you were grabbing your coffee to walk out the door. Well, if you're not going anywhere now, if you aren't going to work or whatever social activities, then you don't have that cue anymore to take your medications. Stress and distractions can also lead to errors by just not paying as close of attention as you typically would have. And then for some people, they might have decreased access to any caregiver support that they previously had. They might not be able to have their caregiver come every day or be with them all the time. They might need to be a lot more independent and manage a lot more on their own. So I have some data here for older adults specifically, so adults 60 plus, on how our cases have changed from 2019 to 2020. So 2019 are the orange bars and 2020 are the blue bars. So you can see for medication errors, well, for all of the exposure reasons, cases have increased. But definitely so for medication errors, there's been a 42% increase. And actually this year so far, older adults have accounted for close to a third of all medication error cases for all ages, even though they're just a small proportion of our total cases. So to prevent medication errors, there are, again, a lot of easy strategies that you can employ. So first is storing those meds safely. Always keep them in containers, preferably their original containers or a pill box. If you keep them in a pill box, be sure to keep those original containers so that you still have access to all of the information that's on the label. Keep medications separate from those of other household members. So you could keep them in separate cupboards, separate rooms, separate drawers, whatever works for you. If it's not possible to keep them separate, you can use labeling to differentiate. So it's just like the use of stickers, like mystery X stickers with cleaning products, something that's really easily identifiable. So this slide has some colored bands that are put around pill bottles. So one person could have all blue bands, another person could have all yellow, but it doesn't have to be as formal as that. You could use, again, stickers, you can color the caps in with Sharpies, you can use different colored pill boxes, whatever works best for you. And then always store medications out of sight and out of reach of kids. Remember that containers are child resistant, not child proof. So you want to be sure that you keep everything up and away of little kids exploring. So read medication labels closely. This is especially important if you're taking over-the-counter medications. So you want to check what the instructions say on dosages and the time increments, and if there's a cap on the amount that you're able to take within a 24-hour period. And then you want to check those ingredients because it's very easy to double dose on medications with over-the-counter meds. A good example is acetaminophen or Tylenol. So say you have a cold, you have a headache, you also just have some other flu symptoms, so you take some Dayquil to help with all of those, but then because your head hurts so bad, you take some Tylenol as well. Well, Dayquil has acetaminophen in it as well, so you can end up double dosing if you do that. So you want to be sure to check those ingredient lists, and again, call the Poison Center if you're ever unsure if things can be taken together. Using physical tracking systems is a great way to remember when to take medications if those memory cues have been removed. So this can take a lot of different shapes and forms. Medication checklists are one great way. So that is the very first thing that's going to pop up on the slide. It's pretty simple. You just write the name of the medication and then you check it off after you're done. And that is actually uploaded into your materials if you are interested in downloading those. And for folks either watching the recording or watching the live version, they're going to be up on our website, so I'll post that link. Sometimes the checklist isn't the best option for you. You can use just a calendar, either on your phone or a paper calendar, like a wall calendar, and just check things off. There are lots of different cell phone reminder apps that you can use. The one here on the slide is called MediSafe. It's free, and it'll give you daily reminders or however many reminders you need. And then pill organizers are another good way. So either pill boxes or some pharmacies will even offer bubble wrapped doses. So they'll put together all of your medications for that day and specific time for you. Use a medication list. So A medication list is very important for making sure that you know all of the details about your medication, how to take it safely and correctly. And it's also really important to make sure that you are avoiding any interactions with medications. So you want to be sure in your medication list to include every medication and substance that you use. So that's prescription meds, over-the-counter medications you regularly take, vitamins, supplements, any other sorts of substances. So if you use CBD or anything else. And then for each substance, you need to at least at a minimum include its name, dose, purpose, so why you take it, the time of day that you take it, and any special instructions, like it should be taken with a glass of water, or it should not be taken with this food. And that is also the worksheets are uploaded into the materials section, as well as a guide to help you develop a medication list if you don't already have one, or if you need an updated list. Okay, so wrong medication can happen. So that specific kind of medication error can happen when you keep or hang on to expired, unwanted, or unneeded medications. So the best thing to do is to get rid of those. Don't hang on to them. Some folks don't know how to get rid of them, or they think they might need them later on, so they hang on to them. But it's best to just get rid of them, and you can take them in Washington to secure medicine return locations. So this website, takebackyourmeds.org, it's run by the Poison Center. And we have listed out in both a list format and on a map all of the different secure medicine return locations in the state. So some of them are at pharmacies, some of them are at sheriff's departments. There's lots of different places, but you can search for your specific area. They're always going to be free. Sometimes they don't accept all substances though, so you want to check the website, check the Take Back Your Meds site, and it'll say if there are any restrictions on there. Obviously, we're in COVID times right now, so we don't want folks making unnecessary trips. So our recommendation is to take back those meds if you're already going to be at that pharmacy or wherever the take back location is. Otherwise, don't head out just for an extra trip. Just safely store those medications at home, up and away, and if possible, locked up until you have the opportunity to go to a disposal site. Our last thing within medication errors is to add labeling. You'll hear us talk about labeling a lot. So this is really important with lookalike substances. So we had the Gatorade bottle and the cleaner earlier. Well, this also applies to medicines as well. There are a lot of substances that can look like a medication, but aren't actually. We receive a lot of calls about, for example, people mistaking glue and eye drops or eardrops and eye drops. So you want to be sure to add labeling, Mr. Yuck stickers, markers, tape, whatever works for you. And again, our phone number in case you have any questions about medications. If you have a medication error, please give us a call. The great thing about the Poison Center is that we are always open, so you're always going to be able to get a hold of us, which might be easier than trying to get a hold of your doctor or going to the emergency room. Okay, I will check the chat box again. Please, if you have any questions, let me know. And then same on Facebook, if you have any questions, please comment with them. Okay, I'm not seeing anything. So within medications, we also are concerned right now about self-medicating. There's been so many rumors and so much misinformation out there about different ways to prevent or to treat COVID-19. But we want you to know that there are currently no approved medications, no vaccines, no supplements, vitamins, or any other substance that has been approved or shown to prevent or treat COVID-19. So be very wary if you ever see any products that claim to do so, because using that product could lead to interactions with other medications you're taking or harmful side effects, even life-threatening side effects. So it's very important to practice substance safety with all of these rumors flying around. So talk to your doctor or talk to your pharmacist or call us, call the Poison Helpline before trying anything new, any new medication, any vitamin or supplement, and we can look at what is safe for your body and for your health. Never use any disinfectants like bleach or non-pharmaceutical substances in ways that they aren't intended to be used. And just call the Poison Helpline if you're unsure if something is safe. So these next couple of slides, I will say there's a trigger warning here. I am going to talk a little bit about some other forms of intentional use, including suicidal intent. So this, just like all of these other exposures, we've always been concerned about it. We have some data here from 2019 on the slide of all of our cases, all ages. 17% were intentional last year. 11% were suspected suicide or self-harm cases. But during COVID, there's just so much stress. There's isolation. There's so many factors that are just increasing our risk of anxiety, of depression, of some mental health challenges. So that in turn can increase people's risk of substance use, of self-harm, or suicide. And we have some data out that we just put out earlier this month, I guess, that actually shows self-harm and suicidal intent in specific age groups. So in adolescents, there's an entire snapshot dedicated to them. We've actually seen a 5% increase in cases of self-harm and suicidal intent. And then for older adults, I just calculated this today, we've seen a 13% increase in cases. So that's really heartbreaking, and we don't want this trend to continue throughout the rest of the year. And so it's really important to know what different prevention strategies are, to share them with people in your lives. Take breaks from the news. It's overwhelming. We're just receiving a flood of information all of the time. So it's good to take a step back and just disconnect from it. Set up regular communication with people in your lives, friends, family, other supports. With so much uncertainty that is just continuing to happen throughout this pandemic, it can be really helpful to establish even just brief periods of certainty. And it's also helpful to show that there's still support available despite all of this necessary distance during this time. Reconnect with organizations or social connections that were important to you pre-COVID. A lot of them have figured out ways to be virtual now and are offering support over the phone or online. So check into those churches, libraries, etc., that were important to you beforehand. There are lots of virtual resources as well. I just put a few on this slide, but there are so many. If you or someone you know needs emotional support or is thinking of suicide, contact the National Suicide Prevention Lifeline. That's this phone number here. For immediate help after self-harm, please call 911. Okay, so we have a few tips specifically if you have any kiddos around the household. And so we're gonna start first with hand sanitizer, which is one of the things commented on what you hope to learn about today. So hand sanitizer, in order for it to be effective, it needs to have a high alcohol content. And this alcohol content is stronger really than any alcohol that you would be drinking. So stronger than wine, than beer, than most hard liquors. So because of that, if a child were to get into this or someone else were to get into this, it can be very harmful. It can lead potentially to alcohol poisoning. So just like all of our other exposure reasons, COVID-19 has just increased our risk to it. I have on this slide one of the reasons why risk has increased. There's just a proliferation of hand sanitizer everywhere. It's all over the place. There are tons of new products out there now, and some of them look not really like hand sanitizer, or they have very confusing labels. Like the one up in the upper left corner says it's edible, which hand sanitizer is not edible, so that's a definite concern. Packaging can be really confusing on them. So like there's one in the little mason jar that kind of looks like a shot. The one in the middle has like a sports cap water bottle top on it. Or there's a dosing cup in the top right. Don't know why you would need a dosing cup for hand sanitizer. And then in the bottom right, there are these new packets that look like the little like pureed fruit or veggies or applesauce that kids would eat, but they are actually hand sanitizer, and they have a little label on there that says do not eat. But I mean, if you're a small child, you probably won't notice that or potentially can't read it. So because of that, it is very important to keep those hand sanitizers out of sight and out of reach of kids. So this graph shows our hand sanitizer exposures by age between compared from 2019 to 2020. So the orange bars are kids 0 to 12 years old. The blue bars are 13 to 85 plus year olds. So you can see there has been a significant increase in the little ones being exposed to hand sanitizer. So safely use and store hand sanitizer to prevent those exposures from happening. When kids are using any sanitizer, supervise them, give them just a very small amount, like a dime-sized amount, have them rub their hands together until they're completely dry. Make sure they aren't sticking their fingers in their mouths afterwards. When you're not using the hand sanitizer, keep bottles or packages out of sight and out of reach. And call us immediately if a child does get into hand sanitizer. Don't wait for any symptoms, just give us a call right away and we can walk you through what needs to happen. There's been some added risks during this time with hand sanitizer as well. Not sure if you all are aware of the methanol-based hand sanitizers that were and continue to be circulated. So these are hand sanitizers mainly produced in Mexico, and they have methanol, which is also called wood alcohol, in them. And methanol is a toxic substance. Poisoning can occur from repeated use on someone's skin. That's less likely to occur, but can. But ingestion is the big concern with it, because that can be life-threatening. So if any kids were to get into it, or potentially even adults who might use hand sanitizer as alcohol. So the FDA has a product list that is kept up to date with all of the different hand sanitizers they have tested and identified containing methanol. So make sure that you are checking your hand sanitizer against that list. And if you do have one of those, dispose of that hand sanitizer, stop using it immediately. You can give us a call at the Poison Center if you're concerned about your exposure to it. Just know that it's not going to say methanol on the label, so make sure you check that list. These products are or were circulating in name brand stores like Costco, the dollar store, so you definitely want to be sure to check that list. And there's also been an update to the FDA recall list. They're now also including some sub-potent hand sanitizers. So these are sanitizers that don't have enough alcohol to be effective. So they really won't be helping you prevent COVID transmission at all. So check that same list for the most up-to-date list of products. And our last tip for any households that might have kids around has to do with medications. So we recommend that you take meds out of sight of children. We know that kids like to mimic the adults in their lives, so it's really important that they don't see you taking medications, because then they might want to pretend they're also taking meds and take something that they shouldn't. Check the carpet and floors in your house for any dropped medication. That's what this image on the slide is. It compares medications to candy. And so it can be really hard to differentiate between the two of them. So a kid might find something and pop it in their mouths. It's also important to call medications what they are. They are medicine, not candy. That way you aren't inviting a kid with a sweet tooth to get into some medicine. And then always, when you are giving medication to a child, use a dosing cup or a syringe, not a common kitchen spoon. because measurements vary a lot with those common kitchen spoons. So you want to make sure that you are providing the correct dose. Okay, any questions so far? Not seeing any. So this is our last little section, and it's just going to go over what to expect when you call us. So first, know when to call us. If you ever have a question, or if you ever have an emergency with a potential poison, please give us a call. You can call about yourself, you can call about someone else. It does not have to be an emergency. Call us whenever. We are always happy to help you. Our hours have not changed during this pandemic. We're still open 24/7. And really, it can be ideal to call us first so that you don't have to make an unnecessary trip to the emergency room. You don't burden 911 with a call that we could help with. And it'll ultimately help you save money too by not having to go to the ER. So when you give us a call, you're going to talk to one of our specialists in poison information, or a SPY. So these are all expert level nurses, pharmacists, and poison information providers that have gone through just a ridiculous amount of training in poisons and toxicology. They are highly qualified to talk to you and to handle anything that you have gotten into. Our call center staff, they average about 13 years in the call center. So they are very qualified and they have heard a lot. If they ever need any additional assistance, we have on-call board certified medical toxicologists that are available around the clock. They will help if a healthcare provider calls from an emergency room needing some additional consultation or additional assistance. So they're always available as well. So when you call us and you're talking to a SPY, they are going to prompt you through a series of questions just to figure out what happened. They're going to ask you things like what was taken, how long ago, how much, how is the person feeling, or how are you feeling? It is totally fine if you do not know all of the answers to this. We just want to get a general sense of what happened. And then our SPYs are going to tell you what to do. So if possible, they're going to tell you that you can stay home and what you can do at home, what you need to watch for at home. Most of the time, this is what we can do. I think for older adults, our most recent statistic was 92% of callers who called us first, we were able to keep them at home. But sometimes you definitely do need to go to the emergency room, and our SPYs will tell you that. They'll also tell you if you can drive, if you need to call for an ambulance, and if needed, they will even call the emergency room ahead of time to let them know that you are on your way. Oftentimes, our SPYs will call you back just to make sure everything is all right. You can ask some more questions then. You can always call the poison helpline again with any other questions or concerns that you have. But we like to follow up with you to make sure everything's going all right. So one last time, here is our phone number. Please give this number a call if you ever need assistance with anything. For those of you on Facebook, we're actually gonna, end, well, no, never mind. We're gonna keep the stream going for a little bit. There's one more poll for folks who are on this this go-to training. So Alex will have you launch that. And it's just asking you, how confident are you in knowing how to call us? Give folks a few more seconds. All righty, thank you for that. Okay, so that brings us to the end of our presentation. Please feel free to send us any questions in the chat box. On the next slide, I'll have my email address up as well, so you can always follow up via email. But as Anne mentioned earlier, we do have some upcoming presentations in partnership with Lifelong Recreation. There isn't one in September, but October, November, and December, we have things scheduled. We don't have registration set up for these presentations just yet, so I recommend just checking our Facebook, and I'll be sure that everything is posted on there, and that will include registration information. But here is my contact information, and then the Lifelong Recreation website and their Facebook page. So feel free to reach out to any of us with any questions that you might have. And thank you so much for joining today. Really appreciate the opportunity to speak with you all. Wish it could have been in person, but who knows when that will be able to happen.